Good day! I'm Alexandra Pineda of BSN 32, and I will be performing female catheterization, specifically the indwelling type of catheter. Along with this video, I will also be inserting clips that are distinct with the demonstration of male catheterization. Let's start with the assessment. Assessment should focus on 4 areas. First, the type of catheterization ordered. It can be indwelling, straight, or residual. Second, the status of the bladder. This pertains to the distension of the bladder before catheter insertion. Third, if there are any abnormalities in the genitalia. And fourth, if the patient is allergic to any iodine-based antiseptics. Assessment helps in determining the patient's need for a certain intervention or procedure. In this case, the physician ordered for a catheter insertion because the patient cannot void on her own. With that being said, this catheter insertion will allow emptying of her bladder and also for the continuous and accurate monitoring of the patient's urinary output. Assessment data will also be used in comparing with the post-assessment data for evaluation. If the patient is allergic to any iodine-based antiseptics, alternatives or proper replacement must be done to avoid allergic reactions that can be detrimental to the patient's health. Next, the equipment or the materials needed for this procedure are: I have here 2 basins. So this first basin contains warm soapy water and this second basin contains warm water only. So this will be used for cleaning the genital area later. So I also have here 3 towels. So this first towel will be dipped here in the warm soapy water. The second towel will be used for rinsing, which will be dipped here in the warm water. And the third towel will be used for drying. I also have here non-sterile gloves and also a linen saver and a large towel or large cloth for draping. I also have here the indwelling catheterization set. So this set contains a pair of sterile gloves, a specimen collection container, the Foley catheter, wherein the tubing and the drainage bag are already connected. And for the females, 14 to 16 French catheter is usually used, cotton balls, 2 drapes, antiseptic solution, forceps, lubricating jelly, and a pre-filled syringe which will be used for the balloon inflation, which will be done later on. The additional equipment or materials needed are tape or a micropore tape, pen, goggles, and we must also ensure that we have a good lighting so that we will be able to identify easily and correctly the anatomical parts of the patient's genital area. So this tape will be used in securing the tubings later on, and this pen will be used for documentation, and goggles are also worn when the patient has urinary incontinence. But in this case, my patient cannot void on her own, so I won't be needing any goggles for this one. First, perform hand hygiene. Hand hygiene is always done prior to any procedure or patient interaction. It prevents the transmission of the microorganisms which can lead to infection or complications that can be detrimental to the patient's health. The next step is to prepare all the materials or equipment needed. So it is very important to prepare all the materials beforehand to ensure that everything is readily available so that there will be no delays and there will be a smooth and easy flow of the procedure. We will now be interacting with the patient. Magandang araw po. Ako po si Alexandra Cathlene Pineda, student nurse mula sa Pamantasan ng Lungsod ng Manila. Kumusta na po kayo? Okay lang po ba kung tignan ko? Ano pong buong pangalan nyo? Araw po ng kapanganakan o birthday? Okay po, salamat po. Verifying patient's identity is very important to ensure that we are doing the procedure to the right client. We can do this by looking at her wristband or hospital wristband, asking for her full name, and also for her birthday. Miss Maddie, meron po kasing order si Doc ngayon na kailangan po kayo i-catheter. Pero ipapaliwanag ko po muna kung ano po yun. Pero bago po yun, okay lang po ba na umupo po muna ako? Para po mas magkausap po tayo ng mas maayos at mas komportable po. Sige. Miss Smiley, kailan po ba kayo huling nakaihi? Kahapon pa po. Matagal na. Ayun nga po, gaya nga po ng sabi ko kanina, may order nga po si Doc na kailangan po kayong i-catheter. Pero bago po yun, tignan ko po muna yung dito po sa bandang parte po ng baba ng tiyan nyo. Okay lang po ba? Okay. Ayan, nakaumbok po. So, naana ko po ngayon na puno po yung lugar kung nasaan po yung ihi po ninyo. Yung catheter po ba o sonda po, narinig nyo na po ba? May ideya po ba kayo or naranasan nyo na po ba? Hindi pa po. So, yung catheter po kasi o yung pagka-catheter, bale, may ipapasok po ako na manipis po na tubo. Doon po sa parte po ng puwerta ninyo na tinatawag pong urethra or yung urethral meatus. So, yung butas po kasi na yun, doon po lumalabas yung ihi nyo po. Po ay kagaya nga po ng sinabi ninyo, hindi po kayo nakakaihi. And ayun po, yung catheter po na ipapasok po natin o yung manipis po na tubo po na yun, makakatulong po sa inyo para po mailabas nyo yung ihi po na naimbak po sa loob. Opo, hindi po kasi pwedeng magtagal ng ganong katagal talaga yung ihi sa loob. Kasi, di ba po, ang ihi, yan po yung mga dumi na rin natin sa katawan na kailangan talagang ilabas. Opo. May mga tanong po ba kayo? Yung mararamdaman nyo po. Habang pinapasok ko po yung catheter, or yung manipis po na tubo, may mararamdaman po kayong parang pressure po. Opo. Pero aalalayan ko naman po kayo. At saka sasabihin ko rin naman po sa inyo yung mga kailangan nyo pong gawin para mas maipasok natin ng mas mabilis at mas madali po. Opo, kagaya po ng iiri po kayo ng kaunti habang pinapasok ko po at hihinga po ng malalim para po ma-relax po natin yung mga muscles nyo po dito. Opo. Pumapayag po ba kayo na gawin po ito? Okay po, talaga makakatulong po ito sa inyo. At saka po pala, Miss Smiley, habang po ginagawa natin po yung pagsusonda po sa inyo, paalala ko lang po na huwag po masyadong malikot. Opo, kasi hindi po natin pwedeng hayaan na may makapasok po na mikrobyo po sa loob ng inyong katawan. Opo, kasi magkakasakit po kayo nun. Okay po. Saglit lang po ha, isarado ko po muna yung mga kortina. Providing privacy by closing the doors and closing the curtains, especially if the patient is in a ward, helps in maintaining client's dignity, and it also decreases embarrassment, which helps the patient be comfortable during the procedure. Miss Smiley, tanong ko lang din po kung may allergy po kayo sa iodine o sa iodine. Ito po palang sinasabi kong ito po yung kadalasan po na nakikita or ginagamit po natin na palinis ng sugat. O kung matatandaan nyo rin po or kung familiar kayo, mas kilala po siya sa pangalan o tawag na betadine. Wala naman po. Okay po. As I said earlier, we need to determine if our patient is allergic to any iodine-based antiseptics. And if yes, we need to use an alternative for this to avoid any unwanted allergic reactions. We will now be donning non-sterile gloves to prevent contamination of hands and prevent exposure to body secretions. Additional information, if catheterization is being done for residual urine, ask the client to void in the bedpan, measure and record the amount voided, then empty the bedpan. This will determine the amount of urine the client can void without catheterization. After donning non-sterile gloves, I will now lower the side rails and assist the patient in a supine position. This will facilitate comfort and access to the urethra. Then I will also place a linen saver under her buttocks to avoid soiling the linens. Flex nyo lang po or i-bend nyo po yung kaliwang tuhod nyo. Then, kapit po kayo kay nurse na nasa kabila habang tumatagilid po kayo. Kanan na tuhod naman po yung i-bend. Tapos, kapit po kayo sa akin habang tumatagilid po. Since we already have adequate lighting for visualization and for clearly identification of the anatomical parts, I will no longer add additional lighting for this. I will now place the patient in a dorsal recumbent position, wherein the lower extremities are moderately flexed and rotated outward. So this position is used to expose the genital area of the patient. Miss Smiley, tataas ko na po yung kumot nyo, ha? After that, I will now separate the labia using my thumb and my forefinger by gently lifting it upward and outward. This will help me identify the urethral opening clearly before the area is cleansed. I will now be washing the genital area of the patient. But first, I will check the temperature, and the temperature must be warm. I will check it using my elbow. Miss Smiley, ano rin po yung kamay niyo dito. And tignan niyo po if okay po sa inyo yung temperature. Hindi naman po masyado mainit at hindi rin po malamig. Maligamgam lang. Ito rin po. Okay naman po. First, I will dip the towel or the first towel here in the basin with warm soapy water. Then after that, I would like to wrap the towel around my hands like this. As you can see, there are 3 sides. The first side, the second side, and the third side. So the first side, I will use it in wiping this part, like this. Remember to wipe it or wash it from front to back. Then the second side, I will use it in this part. And the third side, I will use it here. Then after that, I will use the second towel and I will dip it in the basin with the warm water. This towel will be used for rinsing. Again, I will wrap the towel around my hand like this. Same way or same procedure, just like what we did in the first towel. First side, second side, third side. After rinsing, we will now pat it to dry. So this is the third towel. Remember, in drying, we must not wrap it. We should just pat it. Like this. So for male patients, instead of being in a dorsal recumbent position, the patient will be placed in a supine position. If the male patient is uncircumcised, retract the foreskin, then place it back after washing. I will now dip the first towel in the basin with warm soapy water. So I will be washing the tip of the penis at the urethral meatus first. Then using a circular motion, I will clean from the meatus, then outward. So this direction of cleaning moves from area of least contamination to area of most contamination. So it will prevent the microorganisms from entering the urethra. After that, I will dip the second towel in the basin with warm water for rinsing. Then lastly, the third towel for drying. Just pat it. Then we will discard the bath water, the towel, and the washcloth in the proper receptacle. This is done to decrease clutter and reduce microorganism transfer. Since the Foley catheter and the drainage apparatus are already connected with each other, I will not demonstrate the steps under number 14 in the checklist. The client will remain in the dorsal recumbent position to further expose the labia. Then I will drape the client to provide privacy and reduce embarrassment. After that, I will now discard my gloves and perform hand hygiene to reduce microorganism transfer. But before that, I will lift the side rails to promote safety and make sure that the client is covered to reduce embarrassment. I would like to apologize first for my background. So this video is purely for demonstration purposes only. But in the real life, the area should be spacious and far from contaminated objects. And this table should be in the waist level to be considered as sterile. So setting up a sterile field. So let's assume that this catheterization kit has an outer package or an outer wrapper on it. So I will open this catheterization kit by first carefully removing the outer package. So the outer package must be turned inside out just like this. And this outer package should be taped in the bedside table because it can be used as a waistband. After that, we will place this catheterization kit between the client's knees. So this is done to ensure that the items are within easy reach. So assuming that we already placed it between the client's knees, I will now open the outer edges of this catheterization kit. Be careful not to touch more than 1 centimeter from the outside or from the outer edge. Okay. Then I will now take off this drape from the catheterization kit and place it under the buttocks of the patient. So this provides a sterile field. The procedure is just the same with the previous clips that I've shown. However, instead of rolling to sides, the client will just raise her hips and we will place this drape under her buttocks. Then I will don sterile gloves to avoid contaminating other items in this kit. I will now pour the iodine solution in the cotton balls. So this prepares the cotton balls for cleaning. So the iodine solution is used because it removes the germs from the skin. So I will now separate the cotton balls using forceps for easy manipulation. Now I will pour out the lubrication jelly out of the syringe. I will now examine the catheter tip. The catheter tip is intact. With that being said, I will now lubricate it with the lubrication jelly, 3 to 4 inches of the catheter tip down. So for male patients, the catheter is lubricated 6 to 7 inches from tip down. Examining the catheter tip prevents the use of damaged catheter. So we also lubricate the catheter tip to promote ease of insertion and avoid irritation of the meatus during insertion. Since we will be inserting an indwelling catheter, we will be attaching the pre-filled syringe of sterile water in the balloon port of the catheter. So the balloon port is rubberized. That's why we will be needing the needle of the syringe. And because of the revised guidelines, we will no longer be testing it, or we will no longer be doing the pre-inflation of the balloon. Since the drainage apparatus is already connected with the Foley catheter, I would like to keep it here to maintain its sterility and avoid contamination. I will also check the clamp on the drainage bag or in the collection bag to be sure that it is closed. So this is done to prevent soiling of the sterile field and the loss of urine before measurement. I will now open the specimen collection container and place it on the sterile field. This is to ensure that the container is within reach for specimen collection. However, I do not like to fully uncover the lid, just like this, to prevent contamination from the air. So just put it like that. I will remove the fenestrated drape from the catheterization kit and put it over the perineum to expose the labia. So this expands the sterile field. Using my non-dominant hand, I will be separating the labia minora to expose the urethral opening. And using my dominant hand, I will be holding the forceps and pinch the cotton balls with the iodine solution to cleanse the genital area. Remember, front to back. And then, do not cross the sterile field with the contaminated cotton ball. Discard. Avoid also going back and forth to avoid cross-contamination. The next. Again. Then discard. Wipe the center. Again. Discard. Repeat it. Discard. After all the cotton balls have been used, I will now discard the forceps to prevent contamination of the sterile field. I will now move the cleaning tray, which contains the urinary catheter and the drainage bag, closer to the client. And now we are ready to insert the Foley catheter. So with the use of my dominant hand, which is also considered the sterile hand, So I will grasp or pick the catheter up about 1.5 to 2 inches from the tip. I will gather additional tubing in my hand so that I could have a full control over the catheter length. And I will also encourage my patient to bear down and breathe deeply. Miss Smiley, iri po ng kaunti at hinga po ng malalim. Okay. And now I will insert the tip of the catheter. I will insert it slowly through the urethral opening 3 to 4 inches or until the urine returns. Iri po ng kaunti at hinga ng malalim. Ano pong nararamdaman nyo? The urine has returned and I will advance 1 to 1.5 inches more to ensure that the catheter is advanced far enough not to be dislodged and for safe inflation of the catheter retention balloon. Okay. I will now grasp the catheter with the thumb and the first finger of my non-dominant hand and hold steadily. So this is done to keep the catheter from being forced out by the sphincter muscles and avoid contamination of distal portion of the catheter. I will now inflate the balloon with the attached syringe. So let's assume that this is a 10 ml syringe with 10 ml of sterile water. Then I will gently pull back on the catheter until it stops. Okay. I will also remove this fenestrated tip since we are already done inserting the urinary catheter. Discard it to the waistband. I will use my non-dominant hand to hold the penis up at a 90-degree angle to client's supine body. So this straightens urethra to facilitate insertion of the catheter. So after that, if the client is uncircumcised, we will retract the foreskin to expose the penis for cleansing and prevent the contamination of sterile filled later. So, with the forceps in non-dominant hand, I will cleanse the meatus and glans penis with cotton balls, beginning at urethral opening and moving towards shaft of penis. So, I will use circular motion. Then discard. Again. So be careful not to cross the sterile field with the used cotton ball. So after each wipe, we will discard the cotton ball. So in this way, I am able to cleanse the meatus without cross-contaminating or contaminating sterile hand. Then, after all the cotton balls have been used, I will discard the forceps to prevent contamination of sterile field. So with the thumb and first finger of my dominant hand, I will pick the catheter up about 1.5 to 2 inches from tip to give me a good control of the catheter tip. Then, I will also gather additional tubing in my hand to give me a good control of full catheter length. Then, Mr. Smile, iri po kayo ng kaunti, yung parang kapag umiihi po kayo. Then, hinga po ng malalim at mabagal. So, tuloy-tuloy lang po habang ipinapasok ko po itong sonda. Then I will now insert the tip of catheter slowly through the urethral opening 7 to 9 inches. So assuming that the urine already returned, I will now lower down the penis to about a 45-degree angle, especially if there is no resistance met. Then I will advance an appropriate distance around 1 to 1.5 inches to ensure that the catheter is advanced far enough not to be dislodged and for safe inflation of catheter retention balloon. Since the balloon port is rubberized, we will be needing the needle of the syringe. Then I will inflate the balloon with this attached pre-filled syringe with 10 ml of water. So this is done to secure the catheter placement. Then I will gently pull back the catheter until it stops. So again, this is done to secure the catheter placement. Using the tape, I will secure the catheter loosely on the tie. So I will position the tubing on the side wherein the drainage bag is falling from. I will also ensure that the tubings are not being caught up on the railings or are obstructed. So this is done to stabilize the catheter and prevent accidental dislodgement. After that, I will clear the bed of all equipment. Miss Miley, tapos na po tayo. Kamusta po pakiramdam nyo? Baba lang po natin yung legs nyo, ha? Buti naman po at okay lang po kayo. Yung posisyon nyo po ba ngayon? Komportable naman na po ba kayo? Gusto nyo po bang iangat ko yung banda sa ulo nyo? Hindi na po. Okay na po kayo dyan? O, sige po. Taas ko lang din po yung side rails nyo, ha? Para po sa safety nyo. And kung may kailangan po kayo, pindutin nyo lang po yung collar nyo na nandyan po sa gilid. Salamat po! Measure the amount of urine in the drainage bag, which will be documented later on as an assessment data. Then you can also discard the urine and the disposable supplies. Then gather and discard or restore all the additional equipment to promote a clean environment. Remove and discard the gloves in the proper receptacle and perform hand hygiene to reduce microorganism transfer. And lastly, for the documentation, the following should be noted on the client's chart. Documentation is very important. Aside from it has a legal purpose, it also lets the nurse and the other members of the healthcare team know about the current state or progress of the patient. It also facilitates continuity of care and notes how the patient tolerated the procedure. Evaluation lets the healthcare provider know if the procedure is effective or not.